Hello, my name is Savannah. I'm the nurse practitioner taking care of you today. I'm going to wash your hands for your safety, and is it okay if I video this assessment? Can you tell me your name and date of birth?
William Gregory, 5/13/96.
Okay, Mr. Gregory, it's nice to meet you. So today I'm just going to be first starting out by looking at your belly, then we're going to do a musculoskeletal exam, and then a neuro exam. Is that okay? Alright, first thing I'm going to do is I'm going to just look at your stomach. Go ahead and lay flat for me and pull your shirt up. Great. So, that patient's abdomen is flat, it's not distended. The umbilicus is present in midline. There's no pulsation noted. Colon sign is not noted. The skin is dry. There's no lesions, obvious masses, scars, or bruising noted to his abdomen area. The next thing I'm going to do is I'm just going to listen to your belly, okay? With my stethoscope. So vowel sounds are present in all four quadrants. The next thing I'm going to do is I'm just going to listen to your aorta, your renal arteries, iliac arteries, and femoral arteries. We're going to listen to the aorta. The renal arteries. The iliac arteries. And in actual practice, I would listen to the femoral arteries without having the patient's clothes on, but for patient privacy, we're going to listen through his clothes. But the femoral arteries. And there were no bruits noted over the aorta, renal arteries, iliac arteries, or femoral arteries. So next thing I'm going to do is I'm just going to tap over your belly, okay?
Mm-hmm.
So tympany is noted over all four quadrants. The next thing I'm going to do is I'm going to percuss the liver and the spleen. So we're percussing the liver. Now the spleen. So if the spleen and the liver were enlarged, there would be dullness over each one. The next thing I'm going to do is I'm going to press down on your belly, okay? It's going to be light, and then it's going to be a little heavier, okay? Let me know if you have any pain or tenderness. Any pain? So no pain or tenderness noted over his abdomen with light palpation. The next thing I'm going to do is deeper palpation, okay? Let me know if you have any pain. Any pain or tenderness? So there's no pain or tenderness on deep palpation. There's also no masses that are palpable. The next thing I'm going to do is I'm going to assess your liver and spleen, and then we're going to go from there, okay? So you're going to assess the spleen first. I'm going to place one hand under your back and one hand up. So the spleen is non-palpable. Next, I'm going to do your liver. So this liver is not palpable as well. Next, I'm going to do the liver scratch test. We're going to start at the right hip and scratch up all the way to the ribs where the liver lies and see if we hear any changes. So on the liver scratch test, you can hear the sound change from tympany to dullness whenever we're scratching for the liver. The next thing I'm going to do is see if the patient has a positive Murphy's sign. This test is used to examine for acute cholecystitis. Your gallbladder is located in the right upper quadrant. We're going to see if he has any pain. All right, take a deep breath in for me. Any pain?
Mm-mm.
No. So the patient has a negative Murphy's sign. So that means more than likely that his gallbladder is not causing him any issues right now. The next thing I'm going to assess is his appendix for acute appendicitis. All right, okay, the appendix is located in the right lower quadrant, which would be right in this area. Uncross your legs for me, and then lift your leg up. Just hold it straight. Just hold your leg straight, and try to. Is there any pain when I push down?
Mm-mm.
No? Okay. So that's a negative psoas time. Another test I'm going to do for appendicitis is the arbitrator muscle test. So I want you to bend your knee, your right knee. And I'm going to hold it. Just keep your leg straight. Okay? And then I'm going to turn it inward. Bend it toward me. Any pain in your right lower quadrant? No? Okay, so that's a negative arbitrator sign. And the last thing I'm going to do is rebound tenderness over McBurney's point. The McBurney's point lies between the umbilicus and the iliac crest. So what I'm going to do is I'm going to press down and let me know if you have any pain when I press down or release. Any pain? Okay, so the patient has a negative McBurney's sign. So that concludes the abdominal assessment. So the next thing we're going to go to is musculoskeletal and neuro, okay?
Mm-hmm.
So the next part is the neuro exam. I'm just going to ask you a few questions, okay?
Mm-hmm.
Do you know what year it is?
2021.
And what month is it?
March. It's March.
Okay. And who's the president?
Biden.
And what would you do if you found $1,000 sitting on the floor at a store?
Take it to security and return it.
So a patient is alert and oriented times 4. He is relaxed and cooperative. His thought process is coherent. He is oriented to person, place, time. His mood is calm. His affect is happy and appropriate for the situation. His judgment and abstract thinking are also appropriate. So the next thing I'm going to do is I'm going to check your reflexes in both arms, okay?
All right.
So the first reflex I'm going to do is the bicep. Just hold your arm out for me. Perfect. You're just going to feel me tap, okay? Perfect. Next one. Perfect. Now we're going to do the tricep. So I just need you to hold your arm out like this. Just relax. Just relax. Just relax. Perfect. Now the other arm. So just relax your arm. I got it. Just relax. Perfect. And then the next one, we're going to do the brachial radialis. Perfect. Perfect. So his upper and lower extremities reflexes are 2+ bilaterally. So the next one we're going to do is your patellar, Achilles, Babinski's, and a Clonus exam, okay? Just dangle your legs. Alright, just dangle and relax. Okay, and then so next, that was the patellar. Achilles is going to be behind the ankle. Okay, just relax, I got your leg. Perfect. And then, if you will, take off your sock and one of your shoes for me. Take off your sock for me. Thank you. Alright, so next we're going to do the Babinski's test, which we will just draw a J on the bottom of your foot, okay? Perfect. So the patient's toes curled downward and they did not flare upward. So that is a negative Babinski sign on the right foot. Now on your left foot. So again, we're just going to draw a J on the bottom of his foot and the patient's toes curled downward versus upwards. So that is a negative Babinski sign again. So the next thing I'm going to test is the Clonus test. Just keep your shoes off. So just relax your foot. Relax. I'm going to throw it up, okay? And now this one. So the patient has a negative Clonus test. He was able to lower his foot to a normal position without any extra movement. Again, his reflexes are 2+ equally bilateral in the upper and lower extremities. The next thing I'm going to check is your position sense and sensation in the upper and lower extremities. Okay, so I'm going to touch multiple places over your face, arms, shoulders, hands, and you're going to tell me if you feel a dull or sharp point, okay? So for my sharp, I'm going to use a toothpick, and my dull, I'm going to use a Q-tip. So just close your eyes for me. And just tell me if you feel a dull or sharp, okay?
Dull. Sharp. Dull. Sharp. Dull. Dull.
Okay, great. So patient is able to identify dull and sharp sensation in his upper and lower extremities. So the next, I'm going to test the stereogenesis test, and this test is the ability, it gives the patient, shows if the patient's ability to be able to perceive two different items in his hands. So close your eyes. I'm going to hold your palms out for me and tell me what you, tell me what I'm going to place in this hand.
Fingernail clippers.
Perfect. Fingernail clippers.
A pen.
Okay, perfect. So patient is able, you can open your eyes now. Patient is able to identify both objects in his hands without any visual or auditory assistance. The next thing we're going to check is the graphesthesia. And I'm going to have you close your eyes. And I'm going to draw something on your hand and you tell me what it is, okay? Can you tell me what this is?
A J.
Perfect. And now this hand?
A 3.
Great. So a patient is able to recognize the writing on the skin purely based on the sensation of touch. He's able to identify what was written in his hand bilaterally. So the last thing test for the neuro part of the neuro portion is the 2-point discrimination. So the 2-point discrimination is the ability of the patient to identify 2 objects where they are either touching in one spot or 2 spots. Okay?
All right.
So just hold your arm out for me. Okay? And close your eyes. And tell me if these things are together or separate. Is it together or separate?
Separate. Together.
Is it together or separate?
Separate. Together. Separate.
Okay, now the other arm. Are they together or separate?
Separate. Together. Separate.
Okay, now but how about on your leg?
Together. Separate. Together.
Great. So the patient is able to identify 2 distinct objects in several places. So the next thing we're going to do is test your cerebellar coordination. So just rapidly tap your fingers together. Perfect. Okay, now touch my finger, then touch your nose. Touch my finger, touch your nose. Touch my finger, touch your nose. Touch my finger, touch your nose. Now with your other hand. Touch my finger and touch your nose. Touch my finger, touch your nose. Great. So the next thing, just pass your hands like this. Go back and forth. Great. The patient is able to alternate rapid hand patting. So the next thing I want you to do is with your right heel, rub it up and down your left shin. Right. Okay, now swap legs. Perfect. So patient was able to run his heel down each shin of his leg with a smooth shin rub. So the next thing I need you to do is just while you're sitting there, tap both feet on the ground. Okay, and the next thing we're going to do is I want you to stand up. Close your eyes and hold both of your arms out straight with your palms up, just like that. Great. So the patient does not have a pronator drift, and patient also has a negative Romberg test. There's no increase of body swaying or leaning towards one side or the other during this assessment. You can sit down. So, patient also has no tremors, tics, or dystonia noted during the exam. The last part of this exam includes just body awareness and position, okay? So what I'm going to have you do is you're going to stand up and then you're going to walk 10 steps on your tippy toes, and when you turn around, walk back on your heels, okay? Go ahead and stand up. Okay, now turn back and walk towards me on your heels. Perfect. Just stay standing. So the next thing we're going to do is have you just hold your arms out like that and walk in a straight line for me. Perfect. Now turn around and do it again. Great. So I noticed on that exam that the patient's gait is smooth and rhythmic, and his arm sways symmetrically with each step, which is to be expected. And that concludes the neuro part of the exam. The next exam will be the musculoskeletal exam. Okay, so the next part is the musculoskeletal exam. Patient has good posture. His skin is warm. There's no redness, or swelling over any of his joints in his upper or lower extremities. There's no tenderness, nodules. When he moves his wrist, his elbows, his shoulders, knees, other knees, ankles, there is no crepitus noted. His joints and muscles are symmetrical bilaterally in both his upper and lower extremities. So the first thing I'm going to do is I'm just going to check your pulses in your upper and lower extremities. So we have his brachial pulse, radial pulse, his cap refill is less than 3 seconds. Brachial pulse, radial pulse, and his capillary refill is less than 3 seconds. So next I'm going to check his pulses on his feet. So on the top of his foot, we have the dorsalis pedis and posterior tibial, which is on the back of his foot, and his cap refill on his toes are less than 3 seconds. So again, dorsalis pedis, posterior tibial, and cap refill is less than 3 seconds. So his pulses are 2+ bilaterally in his upper and lower extremities. So the next thing we're going to do is we're going to check the range of motion in your neck, your shoulders, your arms, and your legs, okay? So the first thing is we need you to flex. So tuck your chin to your head, extend, put it all the way back. Rotate it in a circle. And then do a lateral bend, so touch each ear to each shoulder. Perfect. So the next thing we're going to do is I'm going to check the resistance against flexion and extension. So what I want you to do is try to push my hand away from me. Like push your head back and try to move my hand. Perfect. Now push forward. Perfect. So patient strength is 5 out of 5. The next thing we're going to do is do the Sperling test. So what I'm going to have you do is just push your head down and tell me if you have any pain when I apply pressure. Any pain? Okay, now the other side. Any pain? No, so patient has a negative Sperling test. He has no pain that occurs when we apply pressure. The next test, the next thing we're going to do is we're going to check the range of motion in your shoulders. Okay, so what I want you to do is raise your arms in front of you. So flexion, hyperextension, push them back a little further. Extend, go like raise your arms behind you. And even higher if you can. Perfect. And then rotate them in a circle. Abduction. So we're going to abduction, we're going to go in front of you. And then the next one is abduction. So go raise your arms to the side and go over your head. Perfect. And then we are going to next do internal rotation. So I want you to put one of your hands behind your back like that. Okay, now the other side. Perfect. Now, external rotation. So you're going to put your arms in front of you at shoulder level and bend your elbows and rotate your forearms to the ceiling. Perfect. So the next thing you're going to do is a scratch test. So you're going to reach over your shoulder and touch your scapula from above. Is there any pain with that?
Nope.
And then the other side? Any pain?
Nope.
No. And then go from the bottom and touch your scapula. Any pain? And any pain? No? Okay. So no pain is a normal sign. Pain would indicate there could be a possible rotator cuff tear. So the next thing I want you to do is just hold your arms up, and I'm going to try to push down on them, okay? Good. So patient strength is 5 out of 5 bilaterally. Next thing we're going to do is the drop hand test. So I want you to elevate your arms to your shoulders. Put your thumbs down. Great. And then I'm going to apply pressure on them and try not to let me push it down. Okay. Is there any pain when I do that? No? Okay. So since there's no pain and the patient's arms are fully abducted at the shoulder level, if there was pain when he was doing that, he could possibly have a supraspinatus rotator cuff tear. The next test we're going to do is the Hawkins test. Pause that. So the next thing we're going to test is the Hawkins test. So we're going to hold your arm out at 90 degrees, bend your arm, and I'm going to rotate it inward and let me know if you have any pain, okay? Any pain? Any pain? No? Okay. Now your other arm. Bend it. Okay, and we're going to rotate it. Any pain? No? Okay, great. So if the patient was to have pain, he could possibly have a supraspinatus rotator cuff tear or impingement. So the next thing we're going to do is test the range of motion in your elbow. So we're going to do flexion, extension, supination, and pronation, okay? So I want you to flex, extend, pronation, and supination. Perfect. So then have it make your elbows extended and try to bring your arms up for me. Perfect. You can put them down. And then the next thing we're going to do is have them flexed and try not to let me push down. Perfect. So patient's strength is 5 out of 5 bilaterally and in both of his upper arms. So the next thing we're going to do is your wrist. So we're going to flex, extend, rotate, radial deviation, so bring your thumbs inward towards you. Okay, we're going to ulnar deviation, yep. And then we're going to squeeze my hands bilaterally. Squeeze, squeeze, squeeze. Good. So patient strength is 5 out of 5 bilaterally, which is a normal finding. So 2 tests that would test for carpal tunnel is this Tinel and Fennell sign. So let me know if you have any pain when I tap over this area, okay? Over the median nerve. When I tap, any pain, numbness in your hands? Nope, this arm? Tapping over the medial nerve? No? Okay, so that was the Tinel. He has a negative Tinel test. The next test is the Fennell test. So I want you to hold both of your hands like this. And we're going to hold for a full 60 seconds, okay? Nope, you got to hold. Keep holding. Any numbness or tingling there? Good. Keep going. You have about 45 seconds to go. Any pain or numbness yet? Nope. We have about 30 seconds to go. Any pain yet? Okay. Got about 15 more seconds. About 10 more seconds. Any pain or numbness?
No.
Okay, so patient has a negative Fennell sign. The next test we're going to do is the Finkelstein's test. You can go ahead and relax. And what I want you to do is grab both of your thumbs and point it down to the ground. Is there any pain in this area? No? Okay. So if there was pain in towards the midnight line ulnar deviation area, the pain would help diagnose de Quervain's tendinosis. So the next thing I want you to do for your fingers, we're going to flex. We're going to make them a tight fist. We're going to extend. Spread your fingers apart. Abduction, bring them together. Abduction, bring them together, and then abduction, spread them apart. Okay? So then the next thing I'm going to do is identify the snuff box on the patient. So the snuff box is right in this area right here. Alright, next, if you will, just stand up for me and we're going to test the spine and vertebral column for range of motion, okay? So we're going to have you flex, so bend forward and try to touch your toes. Perfect. And then you can stand back up and then bend backwards as far as you can go. Okay, and hyperextend even further if you can. Can you go back any further? Perfect. Okay. And then rotate from side to side. Twist, twist. Great. Okay, and then lateral bending. So just bend from one side to the other and try to touch your toes from the side. Just lean side to side. There you go. Perfect. Okay, you can have a seat back down. So the next thing we're going to do is we're going to take a look at your hip, okay? So, can you lay back flat for me? All the way back. Okay, so the next thing we're going to do is check the range of motion in your hips. So what I want you to do is I want you to flex, so bend both knees to the chest. Perfect, and you can relax. Now roll over onto your stomach for me. Okay, and we're just going to, I'm going to lift your leg, okay? We're going to extend and then hyperextend. And we're going to extend and hyperextend. Perfect. You can roll back over. The next thing we're going to test is the abduction and adduction. So go ahead and lay back. I'm just going to lift it. I'm going to do everything for you. We're going to bend. We're going to go out and in. Okay, now this leg, we're going to go out and in. Perfect. So the next thing that I want you to do is try to pull my hand away, push, pull. I'm going to try to pull my hand, don't resist it. Great, now on this side. Perfect. So patient strength is 5 out of 5 bilaterally in both hips. So the next thing we're going to do is a single leg raise test. And this test is to see if the patient has any low back pain that radiates down to the thigh and leg, commonly known as a sciatica nerve pain. So the patient's going to be laying flat. And I'm just going to lift up your leg. You tell me if you have any pain in your lower back, hip that radiates down your leg. Any pain? Any pain? No? Great. So patient has a negative straight SLR test. So the next thing we're going to do is we're going to work on your knee. We're going to check the range of motion in your knee. So I want you to flex and extend your knee. Flex, extend. Flex, extend. Okay, so now try to push my hand out. Perfect. Now try to pull your leg towards me. Perfect. Try to push me away. Perfect. Now pull me. Perfect. You can relax your leg. So the next test we're going to do is the bulge test. This test is used for knee joint effusion. So with the knee extended, I'm going to place my hand above your knee and apply pressure to the suprapatellar pouch. And we're going to milk it down, the fluid down, in a stroke-like volume on the medial aspect of the knee and apply pressure. This would let us, then we're going to tap the knee, and it would let us know if there is a possible fluid on the patella. So this is where we'll hold. We're going to milk, and then we're going to tap. And there's no fluid wave. Same thing on this knee. We're going to milk, and then we're going to tap. And there is no fluid wave. So that would be a negative test. The next test we're going to do is the ballottement test, and this is going to tell us if there's any knee effusions. So we're going to apply pressure here, which is in the ballottement notch, and then we're just going to tap the patella. And there's no fluid wave. So after that, we're going to do the McMurray test. This test is to see is there a medial and lateral meniscus tear. So what I want you to do is I'm going to grab your heel and your knee, and we're going to bend it. And then I'm just going to apply stress, and then we're going to externally rotate. Is there any pain? No? Okay. Same thing with this side. We're going to bend, relax. You got to relax for these tests. Perfect. So now we're going to externally rotate that knee. Any pain? Okay, great. So that would be a negative McMurray test. There's no palpable click or pop along the medial or lateral joint line. So there does not seem to be a tear in the posterior portion of the medial meniscus. So the next test we're going to do is the anterior jaw test and the posterior jaw test, okay? So what I want you to do is I want you to bend your knees. I'm going to place my thumbs right beside the patellar. Any pain? Now I'm going to pull. Any pain? Any pain? So patient has a negative anterior and posterior jaw test. So a negative test means there is no ACL or PCL injury. The next test we're going to do is the Vargas and valgus test. So what I'm going to do is I'm going to grab just right at your ankle and your inner thigh, and I'm going to try to put resistance on it and tell me if you have any pain. No? No pain? Okay. So patient has a negative Vargas test, so that means there's no LCL injury. The next test is the valgus test, and what I'm going to do is I'm going to grab your ankle, we're going to rotate your foot externally, and then I'm just going to push at your knee. Any pain? No? Same thing? I'm going to grab it. Any pain? No pain? Okay. So patient has a negative valgus test, which means there's possibly no MCL injury. The next test we're going to do is the Latchman test, and this test will show us or help give us a better determination if there's an ACL injury. So what I'm going to do is I'm just going to grab above and below your knee, and I'm going to just try to twist, okay? Tell me if you have any pain. No? Any pain? No, so patient has a negative Latchman test. Lastly, we're going to look at the range of motion and strength in your ankles, okay? And your so we're going to have you flex, bring them up, extend, or plantar flexion is bringing your toes downward. Dorsal flex is going to bring them up. We're going to rotate in circles. We're going to inversion, which is rotating them inward, and eversion, which is rotating backward. Same thing on this side. So we're going to plantar flex, dorsal flex, inversion, exversion, and then rotation. Okay, so next what I want you to do is I want you to try to push my hand down like a gas pedal. Push your feet down. Push, push, push. Great, now pull up. Pull up. Perfect. So patient has 5 out of 5 strength bilaterally in his ankles. So that has completed our abdominal, neuro, and musculoskeletal exam. Do you have any questions about anything we've done for you today? No, it was a pleasure taking care of you.